going to learn about the communication skills. Communication skills are not only important for community but also it is necessary or essential part of whole nursing care. We the nurses need to learn about the skills of communications because through communication we can identify the needs of the family or patient. So after the communication or through the communication we can identify the needs, and after that we decide plan of care of a particular patient or family. So communication is very essential part of nursing. So first we have to know the what is communication. So here it is. What is communication? Communication is the process of passing information and understanding from one person to another. Communication is the process of passing information and understanding from one person to another. It is the process of exchanging ideas, thoughts, opinions, information, etc. So basically the communication word derived from communicare, which is a Latin word. So communicare, it means to participate or to impart or to transmit. So communicare means to participate, to involve, to transmit. Okay. So it is a process of using words, sounds, signs to express your or a particular person's ideas, thoughts, feelings to someone else. So next I come to importance of communication in nursing. So first is exchanging information regarding health. So through communication with the healthcare person, we exchange or we transmit our important information regarding patient, regarding client, regarding family to the another healthcare provider, or exchanging information regarding health means here in case of community health nursing, with the community health nurses we provide information regarding health, regarding prevention of disease condition, regarding nutrition to the community people to enrich their knowledge. So next point is encouraging cooperation, coordination, good personal relations and motivation among health workers. So through communication between the healthcare provider, among the healthcare provider, through communication the relationship are improved between the healthcare workers, like through communication their the cooperation, coordination are improved. So basically it improves their relationships. So that's why indirectly it improved the quality of care of a client or a patient. Next is maintaining continuous public contact. Through communication we can up to date, we can enrich, we can improve our knowledge. Besides that, if we continuously communicate with the community people, then public the public or the people, community people and the healthcare provider, both of them improve their relationship and contact. So through communication between the healthcare provider and the community people, the relationship is improved. and the contact is maintained and continuous. So next, fourth point is obtaining feedback from community or health workers. So through communication, by the communication, the sender get feedback about his or her message, and after that she or he can make change in his or her message. Means in community health nurse, means in community nurse, suppose health nurse provides message to the community people, and after receiving feedback from the community people, she can change her plan of care or the doubts of the community people. Means after providing any health education to the community people, and after that you take feedback, and in feedback community people told you that she or he has any doubt, then you can modify it, you can uh, clear it. So through feedback, through taking of feedback or obtaining of feedback from the community people, the health workers can modify, can improve their teaching ability or plan of care, or can resolve their doubts, resolve the community people's doubt regarding the education or any message. So next is elements of communication. So there are mainly 7 elements are present. So first is sender. The term sender, you can understand that sender comes from send. Means here the sender is the person who initiating the communication or who start to share a message. So sender is the first element of communication. The person who initiate or who start the message, who start the communication process, that is sender. Next is message, the specific set of words, gestures and images that the sender uses to convey what he or she wants to say. So the message is the specific sets of words, it may be gesture, it may be image, it may be anything that is conveyed to the receiver. This means the message is the information, the content that the sender wants to convey. It is simply the content of the communication, which is sender wants to convey to the receiver, that is message. Subject matter, which is conveyed by the sender. Next is encoding. The communication process begins when the source or sender selects words, symbols, pictures and means encoding is the it is a main part of communication process where the sender sends the message, and which is symbolized, which may be symbols, words, pictures, etc. Means here the sender who sends the message or the subject matter, which is represented by, it may be represented by words, it may be represented by symbols, it may be represented by pictures. So here the sender sends the particular subject matter or the message which is represented like any way, like words, like it may be symbols. So that is encoding. Means how it it is represented, how it is represented, that is encoding, which is decided by sender. So sender encoded the message. So sender is the another name of sender is encoder, because he or she encodes the message. He or she decide how she wants to or he wants to represent her or his message. That is encoding. That will be delivered to the receiver. Next is communication channel. A communication channel through which the sender sends message to the receiver, means through channel message moves from sender to the receiver. মানে how the message is moves through a channel, that is communication channel. Next is receiver. Receiver is the person, or it may be group of people who receive the message. The receiver has the responsibility to receive the message with the same meaning and spirit as intended by the sender. So receiver is the person, or it may be group who receive the message from the sender. But receiver has a responsibility, that is the receiver has to receive the message in the same meaning, same feeling, same emotion, same spirit as the sender sends the message. Next is decoding. Decoding is the decoding is the part of the communication process. Decoding is done by receiver. It is the process of converting a message into thoughts by translating the received message into a interpreted meaning. Means decoding is the reverse process of encoding. Here, after receiving the message, the receiver translate the message according, or the simplify the message according to him or her, and interpret the message. So it is called decoding, means translating the message or converting the message into thoughts. Last is feedback. Feedback, it is a verbal or non-verbal process in which after receiving the message, the receiver shares his or her feelings or opinions or response to the sender. After receiving the message, the receiver sends her feedback or her response about the received message. Means after receiving the message, the receiver shares her response and his or her opinions about the received message to the sender. So it is feedback. Feedback is very essential part of communication process. So here it is the process of communication. So source, here the source means the sender. Sender sends the message to encode the message, then sends the message through channel. Then after that, receiver decode the message, decoding, receiver decode the message. And here is feedback. Feedback is the response towards the sender. After receiving the message, receiver sends feedback to the sender of the received message. And here it is noise. Noise is the barrier of communication process. Next video I will discuss about the barrier of communication. So here noise is the barrier of communication.